PTF members, our visitors today, as we can see, the CMD of the National Hospital, Abuja, Dr. Jafar Momo, is with us today. We're also glad that we have the CMD of University of Abuja Teaching Hospital, Professor Bisala Ekele, has also joined us. We have the CMD of the Federal Medical Center, Jabi, Abuja, Professor Saad Ahmed. They are all joining us for the first time. So we want to warmly welcome them to today's national briefing of the PTF. For our viewers at home, our listeners who are also following, and those on the online service, we want to thank God that we're here once again to brief you on the current happenings on COVID-19 in Nigeria. And to kickstart our briefing for this evening, please permit me to invite, respectfully, the Chairman of PTF and the Secretary to the Government of the Federation to the podium. You're welcome, sir.
Members of the Presidential Task Force, permanent secretaries, distinguished ladies and gentlemen of the press. I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Tuesday, 29th of December 2020. Let me, on behalf of the Presidential Task Force, extend to all Nigerians, and particularly our friends from the media, our prayers and our wish that the blessings of Christmas be upon you all. It is our sincere hope that you all played safe and observed all the known pharmaceutical interventions during the festivities. The new year, 2021, is just 3 days ahead of us. And we wish to remind you that in addition to the MPIs and the hope given by the arrival of vaccines, commitment to personal survival and compliance with protocols will remain critical. We urge Nigerians to make this part of their New Year resolutions. Our national response is passing through a challenging phase due to the seriousness of the second wave of infections in Nigeria. Week 52 has so far given us the highest number of infections in a single week to date. Our TPR analysis shows that 16 out of every 100 tests carried out are positive. We are also seeing increasing transmission among younger people, and this is not considered good and safe. We must therefore exercise utmost restraint by taking responsibility. The Presidential Task Force this afternoon discussed two very critical issues, namely, one, oxygen supply, and two, case management. With the increasing number of infections and hospitalization, our objectives are to, one, ensure that infection prevention and control, IPC, is properly instituted to minimize spread and exposure of healthcare workers to the virus. Two, ensure that those who require hospitalization are well managed. Three, those requiring medical attention for other ailments gain access to treatment at medical facilities. And four, critical care is available and deployed, especially where oxygen is needed. The situation in Abuja and its environs has been of concern to the PTF. During our conversation with health authorities, including the CMDs of the federal tertiary institutions in Abuja, the National Hospital, Jabi and Gwagwalada medical facilities this afternoon, the PTF directed that the level of infections, prevention and control, as well as case management, should be prioritized immediately. The Honorable Minister of State Health would elaborate on this. You will recall that we recently issued some protocols to states, to which a number of states have been actively implementing. We thank these states and the governors and urge others to follow suit. Closely related to these protocols is the fact that the strategy of testing to detect and treat remains central to the role states are expected to play. Data shows that despite the resources already made available to subnational entities, testing is very low across states in varying degrees. This is not helping our national response. Indeed, some states have not reported any infections in several weeks. Reports received also point to the fact that laboratories recently established in the states are not working optimally. You will recall that we moved from 2 laboratories at the outbreak of the pandemic to about 90, both public and private, located in all states of the Federation. Their inability to function optimally has resulted in unacceptable levels of delay in receiving results and pressure on the national reference labs. We wish to urge all states to reopen all laboratories and ensure that testing is expanded and turnaround time for results is substantially reduced. I was just sharing with one of the staff of the National Reference Lab here in Abuja as to why there are delays in results being transmitted to persons that have been tested. And he said, "Okay, over the weekend we received, or we have in stock, over 12,000 samples." I said, "Where did you get them from?" His response was simple. States are just transporting samples to Abuja. Why do we have 90 laboratories spread all over the states if samples would be shipped to Abuja? We urge subnational authorities to reopen all labs and begin testing. In the same vein, states should please keep their isolation and treatment centers open because of the rising cases of infection nationwide. The PTF has worked out additional quarantine protocols to be observed by travelers arriving from the UK and South Africa. This, I believe, has already been published along with other protocols. And this is in keeping with our determination to minimize any possibility of importation of the virus or re-importation. The new policy started from Monday, the 28th December 2020. And key changes in the new protocol or policy include a requirement for passengers for 2 additional documents, particularly passengers coming from the UK and South Africa. And these documents are 1, permit to travel, or a QR code obtained from the travel portal after payment for their 7 post-arrival tests, and 2, COVID-19 PCR negative tests with a validity now shortened to 96 hours, meaning 4 days. The Presidential Task Force remains vigilant on this matter, and our relevant agencies are also working on the sequencing to determine the strain found. The Director of Nigerian Center for Disease Control will elaborate on this subject, because there's so much of publications on the new variant, the new strain of the virus that has been identified with South Africa and the UK. With effect from 1st of January 2021, the passports of the first 100 passengers that failed to take their day 7 post-arrival PCR test will be published in the national dailies. These passports, as a deterrent, will also be suspended from the 1st of January until June 2021. At the beginning of my remarks, I underscored the issue of oxygen availability as critical to the success of case management. There is an ongoing review of the chain for the supply of medical oxygen for our medical facilities across the nation. While we work on immediate measures, we wish to express our appreciation to Mr. Raj Gupta and the Abuja Steel Mills for bridging the gap in oxygen requirements in Abuja, with at least 100 cylinders of medical oxygen daily for the next 3 months as part of the contributions of COVID. We are also grateful to the Nigerian Air Force for logistics support and supply of oxygen to health sector in the last 9 months. They have consistently come to our aid whenever we have experiences of shortages of cylinders of oxygen, and also ferry them across the nation from their locations in Yola and other places to our medical facilities. I now invite the Honorable Minister of State Health, and thereafter followed by the DG of NCDC, who would update you from the technical perspective. And I thank you all for listening, and thank you for everything you are doing, in spite of the fact that we are in a holiday mood. You ought to be enjoying the season, but we keep calling you out here so that we can keep Nigerians fully informed of what we are doing in the Presidential Task Force, and also avail them with information where they would assess the risk that is glaring confronting them in their response, personal response to fighting this pandemic. Thank you, and have a good evening.
PTF, our CMDs from the various hospitals here in Abuja, and of course the Secretary of Health in Abuja, media representatives, distinguished ladies and gentlemen. Just a quick update on where we are. As at today, the 29th December of 2020, the total sample tested is 937,712, while the number of confirmed cases is 84,811. The active cases number 12,190, while discharges till date stands at 71,357. And sadly, the number of deaths till date is 1,264. while the case fatality is 1.49%. You recall that our case fatality of 1.49, in spite of increasing number of active cases, as well as morbidity that we have seen, is still an evidence of scaled-up activities and quality of care in our isolation centers. And all our federal tertiary hospitals that run at levels 2 and 3 isolation centers, they have been directed to improve and scale up infection prevention and control measures in order to improve on treatment outcomes and enhance safety of the frontline health workers. This is coming at the backdrop of the recent upsurge in the affected health workers and the sad loss of some. The case management has continued to advocate for the presence of psychosocial support for both patients and health workers. This is necessary because of fatigue and consequential apathy associated with the pandemic. I think it's also important for me to say at this juncture that our experience here in Nigeria is such that we hardly need to make use of ventilators. That is not to say that where indicated, we will not use ventilators. But rather what we have done and what we have seen our people respond to most of the time is delivering oxygen through oxygen concentrators. And this is what has buttressed the need for us to ensure that our oxygen plants are functional. And where we have established gaps, either because of non-functionality of some oxygen plants or where they do not even exist, we need to put this in place. That is ensuring that the oxygen plants are functional, and where they do not exist, we ensure that we establish so that we can make oxygen available as a very potent factor in patient management. So we're doing everything in that regard, as alluded to by the chairman of the PTF. I think it's also important for me to say that we have our treatment protocol. And despite ceding the choice of patient management to clinicians who attend to patients at a given point in time, we need to appeal to the populace out there, because we have seen occasions where some patients might even want to force the hand of the attending clinician regarding a particular drug that they have read online or they have heard that it works. But so far, what we know is that aside dexamethasone, which has been established to help to some extent in hospitalized patients, And of course, the administration of oxygen, where and when required. No other treatment, quote unquote, has been found to be effective in COVID-19. So we are left with the need for us to continue to appeal to all and sundry to respect and comply with the non-pharmaceutical interventions. A face mask appropriately put in place, not jaw mask, not skull mask, not pocket mask, or even bag mask. Because these are the different places that people rather put their mask as opposed to face mask. And it is not appropriate to pull the mask when you want to sneeze, when you want to cough, or even when you want to speak to somebody next to you. Of course, washing of hands with soap and water, running water, the use of alcohol-based sanitizer, physical and social distancing, and avoidance of large crowd. These still remain very potent measures which we continue to advocate. And particularly at this festive period, when the tendency is there for gathering together. Please, if you don't have to go out, don't go out, because you are safest in your home environment. And this is not the time to receive visitors in your various homes. We cannot overemphasize these measures because they remain the potent measures that we give to our people by way of advisories. The various committees that are working in collaboration with National Primary Healthcare Development Agency are still working regarding access to vaccines. And of course, Mr. President has already placed the whole process in the hands of the PTF. That is, to source for the vaccine, to administer the vaccines when available. That will be the major focus, particularly in the first quarter of 2021. But while we are waiting for the vaccines, even when the vaccines are available, don't forget that there are logistics issues in terms of distribution, the supply, distribution, cold chain, and all, what have you. So we're saying that even when the vaccines are available and the administration commences, this will be no excuse to abandon the non-pharmaceutical measures. So even when the vaccines are being administered, we still expect people to comply with the various advisories. So it's on that note that I want to wish everyone compliments of the season. Thank you very much.
WRPS CMDs of our tertiary facilities, Director, Hospital Services, gentlemen of the press, compliments of the season. Thank you very much for making our time to come and join us again. Unfortunately, I don't have good news for you. We just faced the worst week since we started responding to this outbreak. We had more cases in Nigeria last week than in any other previous week since the beginning of this outbreak. Just looking at pictures and images and videos from across the country is a very disheartening situation, because it appears that our messaging, our appeals to Nigerians over the last few months have not been heeded. And we have gone ahead with business as usual. Event centers are full, social facilities are full, so it is no surprise that cases are rising. January will be a tough month, no doubt about it. January will be a tough month, so we have to brace ourselves for the consequences of the activities that we have decided to carry out in December. Our colleagues, the CMDs, are here today because of the pressures that we face across the country. Our treatment centers are filling up. We're struggling to keep up. We're struggling to find the facilities to manage, the oxygen to manage. Every night we're faced with phone calls of patients desperate for care. So unfortunately, January will be a tough month for all of us. It will be tough, but we still have an opportunity to do what we need to do. We've been liaising with the executive governors of states across the country to be more purposeful in implementing the measures that we have agreed on collectively. And we have seen some of them doing that, but many of the states in the country haven't, and pretend as if there will be no consequence. This is the reality we face, so we've got to brace ourselves for January. The other challenge that we're facing, apart from the challenge of the outbreak, is an increasing outbreak of misinformation. Every day we receive broadcast messages on WhatsApp, people sending forth messages that are unsubstantiated and in fact wrong. Not just wrong, they're unethical, some of them are simply unbelievable. But we feel somehow an impulse to send them on with the clause there, sent as received. This causes harm. It causes harm because the more we send it off, the more people believe. Yesterday, a message was circulating all over Nigeria, apparently sent by a distinguished senator of the Federal Republic. I called up this senator yesterday. He had not written anything. He had not said anything. He was surprised when I sent him something apparently signed by himself. He had to respond as best he could, but by then, this message had circulated in Nigeria, circulated in the diaspora, and was being sent back by Nigerians living across the world to us here in Nigeria. So please, this is an appeal. Even when a message seems somehow legitimate and somehow signed off by somebody you know or you think you know, it may not be that person. It's not very difficult these days to put someone's name at the bottom of a WhatsApp message and let it circulate. So please, not everything you read on WhatsApp is true. In fact, probably most of it is not. Like the chair said, there's a new variant circulating in the UK, but like we've said severally, there are new variants of viruses appearing all the time. The question is whether this new variant is associated with any increase in transmission or severity. We don't know that yet. We suspect that this variant is already in Nigeria. It will be surprising if it is not, but we simply don't know yet. So what we are doing are collecting samples of recently diagnosed cases and working to do the sequencing that we need to do in order to verify if this variant exists in Nigeria or not. So that's work that is ongoing. It will take us a couple of weeks to have enough samples to analyze and to then define whether we have this new variant or not. So that's where we are. Meanwhile, the World Health Organization is leading in a more global assessment of how prevalent this new variant is and whether it is actually associated with increased transmission in other countries in the world. So finally, just a few updates on the response. I really want to thank healthcare workers across the country that even as we're speaking, even in the facilities that my colleagues here manage across the federal capital and across the country, in the National Reference Lab today and every day of the year, there are people working very hard, have spent their Christmas, New Year working on behalf of all of us. And we're very grateful to all of them for the hard work that you're carrying out for the country. This afternoon, many of us have met here and also meeting, focusing on various other aspects of the response. The leader, my brother, the executive director of the National Primary Healthcare Development Agency, is also leading in very hard, working hard to make sure that 2021 is really the year that we can make vaccines available to fight this disease. But the reality is that we will not have access to these vaccines immediately, and we have to work hard with the tools that we do have right now to prevent more cases and more deaths. Finally, I really want to thank all of you, gentlemen and ladies of the press, for the support you have provided us through the year, for your reporting, your engagement, and your work on behalf of the country. We're very grateful. You're the connection that we have with Nigerians. Thank you very much for your diligence, even during this very difficult period of the year and the time where you should all be resting. Thank you very much for your hard work and your support through the year. I wish you a very good end of the year, 2020, and all of us a better 2021. Thank you very much.
Thanks immensely.
Members of PTF, distinguished guests, the medical directors, ladies and gentlemen of the press, good evening. From the Federal Minister of Environment, just a quick update. As we are facing the second wave, of course, the Federal Minister of Environment, we are continuing to maintain our surveillance desks across the country in the 36 states and FCT, and also maintaining our environmental health sanitation desk in all the 774 local government. We have also commenced registering and training additional volunteers, because we don't just keep them in the local government, but also in hotspots such as markets, motor parks, train station, and places like that, that we feel there is need to actually educate people on adherence to the protocols and the guidelines in containing this virus. The balance of my remarks will be in Hausa for the purpose of our Hausa listeners. Jama'a assalamu alaikum. Mun sake dawowa. Ba wani abu bane dai abin da muke magana a kai ne tun daga farkon shekarar nan na ita wannan annobar corona. Ta ɗan tafi kaɗan amma ta dawo. Kuma wannan karan ma ta dawo da gayya. Bayan muna gaya muku cewa waɗanda suka fi kamuwa ko tafi musu illa, ana maganan dattawa masu shekara 60 zuwa sama, ko kuma masu waɗansu cututtuka ko cutar hanta ko ƙoda ko wani abu makamancin haka. To wannan karan ƙididdigan da muka yi akan yaɗuwan wannan cutar, wannan sabon dawon da ta yi daga watan da ya wuce.
One of the challenges facing the fight against COVID-19, which is very obvious, is infodemic. The social media is awash with a lot of counterproductive narratives. There are recently videos circulating, emanating from renowned doctors across the world, coming up with a discouraging narratives about the vaccines. What is WHO doing concerning this? And how much counterproductive towards the effort WHO is making in fighting COVID-19 across the world? Thank you.
That's the outlook.
Thank you very much. The question is from Nancy, AIT. Essentially, you will want to know how far we've gone in terms of this vaccine issue. Well, let me say upfront that the routine vaccines that we've been using, that is for childhood vaccine preventable diseases like polio, like whooping cough, tuberculosis, measles, what have you. These vaccines will be managed by National Primary Health Care Development Agency. So, on ground, they have experience behind them. They have facilities on ground as well. So what we're doing is in raising some committees, like a kind of technical working group that will liaise with our National Primary Health Care Development Agency to look at the vaccines for COVID-19. There are so many vaccines right now, and there are many vaccine candidates that will come into the arena. You recall that even as at this point in time, the vaccines being applied, they have not really gone through the whole process. I mean, in terms of giving out the vaccine and monitoring them over a period of time. So that is why for the respective countries where the vaccines have already been applied, whether in the UK or in the US, they have been applied under emergency use authorization. Now, having said that, what that also means is that if and when we have our own vaccines that we have decided, because as at this point in time, we are yet to take a decision, and we are not constricting ourselves, we are not limiting ourselves as to where we will get our vaccines from. We will look for help where that help is available. So I'm saying that even when these vaccines are available, they still have to be subjected to our own due process of regulation, and that is by NAFDAC. Now, having said that, again, in deciding which of these vaccines will suit our own purpose, we will consider the factors of cost, because the vaccines are not free. We will consider the vaccines of logistics in terms of cold chain. Some of these vaccines will need storage of about -70 degrees Celsius, some 20, -20, and some are the regular. When I say regular, the temperatures of +2 to +8, that the regular vaccines that we use in routine immunization, childhood vaccine preventable diseases, some of them will work in that category. Now, we will also be looking at when we have the vaccines, what segments of the population will take priority. We will look at that. And I think somebody once said that there are 6 A's involved in vaccines. The first is availability. If it is available, is it accessible? That is in accessibility. If it's accessible, is it affordable? If it's affordable, is it acceptable? Because already, even when the vaccines are not even available, we are seeing what appears to be vaccine hesitancy. That is, do we even want to take these vaccines? And it's not limited to here in Nigeria or in Africa, even over there. This issue of vaccine hesitancy is there. Then, of course, the issue of administration of these vaccines in terms of, because even when we purchase the vaccines, you know that if you have 100 vaccines, for those that we have right now, that will be for 50, because the vaccines will be administered twice at interval of about 3 weeks to 4 weeks. So all these issues are there, and of course there is also the issue of vaccine accountability, which must be taken on board and factored in whatever we're trying to do. So that's why we have this technical working group looking at all the issues, and of course the issue of safety and efficacy. These are some of the issues that NAFDAC will also have to look into. Yes, there have been cases where some unusual reaction, which may not be anything unusual as well in drug administration. What we call idiosyncrasies, it may not be something that is, widely known in terms of reaction. It could just be a reaction in one or two or a few individuals expressing. These are some of the issues that will have to be taken on board. But having said that, what is not in doubt is that we need these vaccines. And we are working with all relevant agencies. You mentioned the COVAX group, which is being managed, or being modulated, so to speak, by Gavi. Gavi is a global alliance for vaccines and immunizations. And of course, the WHO is also in that picture, which the whole essence, the COVAX facility is to ensure that there is some degree of, equitable distribution of these vaccines so that no country is left behind. And a situation where some countries are already buying up vaccines, even more than required in their domain, gives cause for concern. And what COVAX facility has given to us is, to assure us for at least 20% of the vaccine requirement. So which means that is excluding, of course, the logistics factors, and because when you get the vaccines, you need syringe. You need other things to administer these vaccines. So we will pay for that. But we have to make our projections as to the number. And for us to achieve herd immunity, we will need to vaccinate nothing less than 70% of the population. So if you make that projections, you will know that we'll have, you still have many rivers to cross, so to speak. I think I have answered your question. Unless there is something that I have missed out, then I will be willing to talk about that. But if not, I stop here. Thank you.
The question was on if the new variant is associated with different symptoms. No, the new variant is not associated with any difference in symptoms, difference in severity, difference in outcome. The single difference that we found is that it's more transmissible from one person to the other. And therefore, obviously, at some point, the numbers add up. You have more cases, and it becomes a bigger burden to the health system because more cases end up in hospital. The proportion of people that are severe has been fairly constant around the world. And so what I said earlier, really, we are seeing an increase in cases now. Last week, we had the highest number of cases ever. 2 weeks' time, we will see it happen in severe cases and deaths. They always lag by a couple of weeks, and that's really why we're focusing so intensively on case management, because the inevitable consequence of an increase in the number of cases is an increase in the number of severe cases. So we have to prepare for that. But in terms of the new variant, there's no difference in presentation. It's the same thing: loss of smell, loss of taste, fever, breathing difficulties for severe cases. So it's exactly the same group of symptoms. You also asked about our testing numbers. Yes, we haven't hit our 2 million target. We've tested just under 1 million right now, but that doesn't include the about 80,000 tested within National Youth Service camps. It doesn't include about 200 tested from travel-related tests. So yes, we're not where we want to be, but we've pushed very aggressively through the year, and we will keep pushing in the new year when we push further, especially with the rapid diagnostic test kits, for which we've just gotten approval for WHO a month ago, and we're currently going through a significant procurement process supported by the Global Fund to increase our access to rapid diagnostic test kits across the country. So Rachel, you asked about how we're using this opportunity to strengthen health security across the country. I think this is our biggest challenge as a country. I'll answer your question in 3 critical areas. One, in treatment centers for infectious diseases. We've started a national rollout of infectious disease treatment centers. We've commissioned one at the University of Abuja Teaching Hospital, in the Bingham University in Jos, and in the Federal Medical Center in Kefi. There are 17 of these facilities at different stages of completion across the country. So quietly, we're transforming the landscape for the treatment of infectious diseases. For the diagnostics of infectious diseases, we have a similar program for labs, in focusing also beginning with federal teaching hospitals and tertiary federal medical centers and teaching hospitals. We have one at University of Abuja Teaching Hospital, completed in Ilorin, completed in FMC Owerri. So the same way we're going around the country, putting these facilities next to the treatment centers so that we have bring diagnostics closer to the patients in all our tertiary hospitals. The third aspect is in emergency operation centers. Those will be focused mostly within the state governments, within the state ministries of health. So again, we've supported every state to bear 2. Ogun and Jigawa are now the last 2 states that will have UC. So quietly, we're transforming health security in the country, using the challenges that we're faced to build for the future. And what the chair of the Presidential Task Force has assured us, that we have to make health security a national security issue, because that is what it is. Nothing else has had the impact on the economy globally this year, in fact, for our lifetimes, like this pandemic. So health security has become a national security issue, and something that we have to devote the necessary resources to make sure that, yes, new infectious diseases are inevitable, maybe new pandemics are inevitable, but we can prevent them having the impact on society that this one has had in Nigeria and across the world this year. So I think as we move into 2021 and hopefully have access to vaccines soon, the next challenge is to make sure that we're much better prepared for a similar threat in the future. Thank you.
I want to thank Rachel for this question on self-medication, which I believe it's giving me an opportunity to ventilate the concerns of the PTF, particularly the chairman and the honorable ministers of health. Getting prescriptions via phone or email amounts to self-medication because you have not been examined. The person that gave you the prescription, you cannot even confirm the authority with which he or she is giving the prescription. And was there any examination? Was there any medical history taken before the prescription was given. We know how we handle our medical history in this part of the world. A lot of cases that we are having, even the fatalities we are recording, many of them denied even the health workers their medical history. And that has made the provision of optimal care to be given, not to be given. Now, I will want to address the issue of the protocols. We have the national guidelines, treatment guidelines. In fact, we have reviewed it 4 times. And we have it on the website of the Federal Ministry of Health, as well as the website of the National Center for Disease Control, Nigeria Center for Disease Control. We have been training the case managers nationwide on the implementation of the treatment guidelines, including domestication at the subnational levels. The Honorable Minister of State talked about the 2 commodities that have been proven to be efficacious in the management of COVID-19. Apart from that, apart from those, the oxygen, medical oxygen, and the use of dexamethasone, globally, the treatment, management of COVID-19 is largely symptomatic. And it can only be managed when the caregiver has a good history, your medical history, and takes thorough examination. And we have always, with the directive of the Honorable Minister, been ensuring that we keep the advisories out there to all case managers nationwide. So we don't expect that anybody will be treating themselves at home, except you are under the home care team, which brings me to the issue of the home care protocol. The teams are actually under the supervision of case management team leads that are located in the health facilities, to the extent that if there is any need for you to be transferred, to be referred to a health facility, it will be a smooth transition. And I want to end by saying that beyond COVID, some people may not be killed by COVID, but the way they manage their COVID may end up killing. So it is advisable that you don't spoil your liver, you don't spoil your kidney, you don't spoil your organs because you want to kill COVID. Thank you.
Thank you very much, the Director of Hospital Services, for the enlightenment you have provided. We benefited from that exposition. Well, we've agreed that we invite the chief medical directors of the teaching hospitals around us to be here, and they have elected one of them to respond to the question. So we now invite the chief medical director of the University of Abuja Teaching Hospital, Professor Bisala Ekele, to mount the podium. Thank you, sir.
The chairman of PTF, ministers here present, distinguished ladies and gentlemen. The question to us is that, if I were to paraphrase it, in the first wave, there was need for ventilators. Now we are in the second wave, whether we need more ventilators. And the answer is we do not know yet. But what is certain is all the teaching hospitals and level 3 treatment centers have ventilators, and when they are indicated, they'll be put to use. Let me also add that COVID-19 is primarily a disease of the respiratory tract, and therefore, depending on the degree of severity, there might be need to support the patient with oxygen. And in the various treatment centers, we have different devices that we use to support the patient with oxygen. Simple ones like nasal catheters, face masks, respiratory bags. It's when all of those fail, and depending on the SpO2 level, that we now think of the ventilators. So that most of the patients that need oxygen really do not need a ventilator. But when it is indicated, we shall put them to the ventilator. Thank you very much.
So, in the face of multiplication of videos with a negative narrative on vaccine, what I can say, and then as we emphasized since the beginning of the pandemic, there are two crises going side by side. There is the pandemic itself with the virus, and there is the infodemic, which is a multiplication, overload of information through information and fake news. And as you know, fake news spread even faster than the virus itself. It spread faster than new strain, the fake news, because they create sensation. They create curiosity. The video you mentioned may well fall into that category. But as you know, WHO has advised since the beginning to fight both the virus and the pandemic with the same methodology, the same way we use science and epidemiology to tackle the virus at different stage in different countries in the world. WHO has advised that we also tackle infodemic the same way. We need to constantly look at the source of information. We need to look constantly on the credibility of that information. We need to analyze the information before spreading it. We've heard before, shared, forwarded, as received, without any checking. By doing so, we are contributing to the crisis. And WHO has established indeed a whole team at all levels, at headquarters, in the region, at country level, to study all sorts of information coming in regarding this pandemic. There is a WHO, if you go on the WHO website and you type EPWIN, EPIWIN, it will give you access to a site with all credible information about everything that is being done on this pandemic. I'll encourage you to visit that site. In addition, as you know, WHO has entered into partnership with several media outlets and several of these platforms and networks. For example, during this festive season, WHO has entered into partnership with YouTube to be relaying credible information. WHO has done the same with Google, Instagram, and others. There are some sites like Facebook where if you put some of this information, they will take it down. It's part of the effort WHO is doing to make sure that people receive the best information, the most credible information. And WHO based its intervention on science. We use science to then inform risk communication strategies before devising key messages that are then relayed to the public. But I want to emphasize here is that it's our collective responsibility. We shouldn't be spreading news without verifying them. Yes, There is concern about vaccine. There are all sorts of video, but we need to use the same principle. What's the source? Is information credible? What evidence is out there? And most importantly, how to address it. Thank you.
Thank you very much, WHO rep in Nigeria. You've just taken
Misinformation. In the last 9 months, under my leadership, we've tried as much as possible to steer the PTF away from unnecessary controversies, because it doesn't pay. You end up wasting valuable time addressing matters that do not in any way enhance the national response. So we try as much as possible to avoid controversies and unnecessary distractions. 2, to remain focused on the national response, because that is our responsibility, to work with science and facts and provide relevant information for the people of Nigeria to take personal responsibilities and to make appropriate decisions for their actions to save lives and livelihood. And I can tell you without any fear or with all form of modesty, our national response has been adjudged as successful by international organizations, by our donor partners, by friends that have supported the national response, to the extent that the entire world today is copying our protocols that we had in place several months ago. It's today that some nations are talking about testing and demanding PCR test results, either for inbound flights or outbound flights. Farouk, when did we in place that? Several months ago. It's part of the protocol we put in place to ensure that we protect our citizens. And like I said, our national response has been adjudged to be successful. Even the media itself has adjudged our national response to be successful, because with a population of over 200 million people, with our broken health infrastructure over the decades of years, we've been able to tame the virus. What we are seeing today is a result of the fact that we thought the virus had gone, excited about vaccines. We lowered our guard and began to behave in an irresponsible and reckless manner. And that accounts for this new surge in the virus. The other thing that I want to state is that as part of our national response, we have resourced all the 36 states of the Federal Republic of Nigeria. In terms of grants that have gone out to the states, under the leadership of President Muhammad Buhari, the least amount of money that has been collected by the 36 states is 1 billion naira. The least. President Buhari has resourced the states with about 50 billion naira. Lagos got 10, Kano got 5, 34 of them I think got, one got 2, and 34 I think got 1 billion. If you add it up, we're talking about 50 billion naira, all directed at promoting the activities and the response of COVID-19 in the various states. And that was based on the states submitting their incidence action plans, AIPs. what is their incidence action plans, what they are going to do about testing, about treatment, about isolation centers, and the rest. And all the 36 states, without exception, collected the money. So COVID-19 is real. It exists in the 36 states of the Federation plus the Federal Capital Territory. That much you know. It's just a statement of fact. We are restating it. So I want to assure you that as much as possible, we will remain focused. We will do what we have been charged to do for the overall good of the people of this country. Misinformation is also affecting vaccine hesitancy. And it's not only peculiar to Nigeria, it's all over the world. Even in countries where the vaccines are being developed and manufactured, there's vaccine hesitancy based on misinformation. Most of the viral videos that you have seen all over the news media is generated from these countries where vaccines are being administered or vaccination is going on now. As a presidential task force, we have a responsibility to ensure that we secure for the people of Nigeria vaccine that is effective or efficacious, a vaccine that is readily available, vaccine that is cost effective, because we know we don't have the kind of resources that most of the major players have. So we'll study whatever is available through partnership and coordination by the WHO or COVAD and secure vaccines for the people of Nigeria. Before then, we have a responsibility to embark on mass sensitization of the people of Nigeria as to the fact that these vaccines are safe, they are effective, and a combination of vaccines and the non-pharmaceutical interventions will prepare us to get to the level of herd immunity and get protected and our people secured as we do that. The other thing that I want to emphasize and restate, as part of our attitude, and that's why oftentimes you see we try to avoid any controversy, is because we have a responsibility. We are talking about people's lives. If it was a political matter, we can engage in any form of controversy. But you are talking about people's lives. One life lost means that a breadwinner in a home might not be available. A mother to care for children will not be available. A brother, a sister, a prospective leader, an inventor will not be available. So we are very careful and measured in our approach, and we will remain so. And the fact of it, I've learned a lesson from the American election. That's conspiracy theories abound, and they keep flying as to whether this thing is being done right, or this thing is being done like this, or this thing would better be approached like this. But one of the obvious lessons that I have learned is that as much as conspiracy theories abound for every effort of government, that would not stop the success. It did not stop Joe Biden from winning the American election, as much as conspiracy theories were being bandied around. Conspiracy theories would not stop the Presidential Task Force from being focused and succeeding at the work that we've been given. I would end tonight with a quotation from the Director General of the WHO. I saw this, I think he made that remark last week. And I think it's very instructive. Why he said that, I'm referring to Dr. Pedros, the DG of the World Health Organization. Why he said, and I quote, "We are asking everyone to treat the decisions about where they go, what they do, who they meet as life and death decisions, because they are," end of quote. What you do, with who you meet, where you go, and what you do with yourself during these moments of festivities, treat that as a life and death decision, because they are. At the meeting, we were talking about how to help the gentleman that just passed. This afternoon, we were discussing, because he's a friend to a lot of members of the Presidential Task Force, and we were talking about it, about the need for oxygen, about the need for this, where do we get this, make sure that all the patients or all the patients in the various facilities are well cared for. We came down from my boardroom for this press conference, just for a message to come in, that everything we spoke about, how you could be aided and assisted, has come to a halt because he has passed on. It's real. People are dying. As a matter of fact, I can tell you, I have lost more close friends in the month of December from COVID-19 than from March, when the Presidential Task Force came into effect, to the month of November. December is not over yet, but I've lost more close friends. In numbers, I'm not talking about whether I had lost close friends. I've lost colleagues and friends during the first wave. But in these few weeks, I've lost more in terms of numbers. Yesterday, I was at a service of songs. The day before yesterday, I attended a service of songs, and all sorts of things. It's a serious business, and I hope the media, I believe you take it seriously and communicate it seriously, the effect of what we have created this December. When we get into January, the figures will be higher in terms of infections. If we are recording 1,000 plus, be ready for 2,000 plus when we come into January. Be ready for more fatalities when we come into January, because that's the truth about it. The only way we can deal with this is if we take responsibility for our lives. It's not time to play games. You can't play games with people's lives. We will be bare, we will be factual, we will be guided by science and facts, and we will communicate it as raw as it is to Nigerians. Looking at the events, I saw some video clips of what happened in Lagos over the weekend, and I held the decisions that the Lagos State Governor took by closing down those event centers. I saw one event center with over 500 people congregating. I didn't see a single mass, and they were shocked. That's a super event spreader. One infected person, asymptomatic in that crowd, would end up transmitting to several others, and they go home innocently and they pass it over to their families. If you ask me today, how did COVID-19 get into my household? I won't be able to tell you, because I can't imagine. I have put in place all the restrictions, no visits, even siblings were not allowed to come to my house. But I understand. Somehow, he found his way. And by the time I counted under my roof, not those outside, 9 plus 3 outside, 12. And you begin to think that it's a joke. Let's get serious. And let's have Nigerians understand that we are at a perilous time, and we need to get serious with our response to COVID-19. I wish you a very great and wonderful evening. Thank you.
Thank you very much, the Chairman of PTF. Indeed.
Minister of State for Health, my colleague and brother, the Permanent Secretary, not forgetting our guests here today, the medical directors, chief medical directors of our medical hospitals here in Abuja, and the Secretary of Health for FCT, other members of the PTF here present, gentlemen of the press, good evening, everybody. Thank you so much, the Chairman, for your very kind word of advice. We want to remind Nigerians that we still continue to caution that the second wave of the pandemic is here with us, going by the increasing, rising cases of transmission. From the SGF's remarks, we realized that out of 100 tests conducted, about 16 test positive. So that calls for a serious concern, and it means that we have to be more cautious in our dealings. To that extent, states have been advised to, because of the increasing wave, open up their testing facilities, open up their treatment facilities to be able to match with the upsurge. For returnees too, we've been advised, please endeavor to do your post-arrival tests at day 7. It's very important. This will help to save lives, save the lives of your loved ones around you. As we continue to celebrate this during this season, you are advised, please stay away from large congregations, avoid large crowds, avoid attending to so many events. That is one way you can save your life beyond 2020. If you must celebrate, please, you are advised to celebrate responsibly. And of course, if you have not traveled by now, the season is almost over. It's advised that you stay back. Enjoy yourself here. You have a few days to the next year. Traveling may not be the best at this time. And then, of course, if you've traveled already, you are advised to play safe while in your trip. We've been told by our sister, the director from Ministry of Health, that you have to be cautious the way you manage this virus in you, so as not to kill your vital organs through self-medication. Of course, you've been reminded that picking up prescriptions from the social media amounts to self-medication, and that can be dangerous. Please endeavor to live beyond COVID. Finally, avoid fake news. You might be causing more harm to an already harmed situation. Until we see again, I want to wish you all a happy celebration and, of course, a safe transition to the year 2021. God bless all Nigerians. Thank you.